We're turning the clocks back an hour this weekend. A lot of people are saying to end daylight saving time or savings time, depending on your preference, is bad for your health. Now, I'm not a doctor. Got a year and a half of pre-med, couldn't hack it, so I became an attorney. There you go. Figure that one out. The human brain has a biological clock, circadian rhythm, runs on a 24-hour cycle. And this is according to different studies, and I think the Mayo Clinic also. Some studies show that when we switch out of daylight saving time, as the U.S. does every fall, it disrupts that natural sleep cycle and causes disruption to your sleep schedule, whether it's gaining or losing an hour of sleep. I have that problem. It doesn't matter whether we're on daylight saving time or not. But with me is Dr. Fahmi Farah, a medical expert and a cardiologist based right here in Texas. Dr. Farah, am I saying your name correctly?
You are.
Okay, good deal. How serious is this? I mean, I've had insomnia since I was 14 years old, so I'm up and down all hours of the day and night. As long as I get 6 to 7 hours sleep, my voice holds up for what I do. But for other people, is this really a serious problem?
It's hard to say if it's a serious problem, but it does disrupt sleep for many people who are sensitive. As you mentioned, the circadian rhythm, we all have that, and some people are very sensitive. If we get change or switches to our sleep pattern, it can cause them to have sleep disruption, cause their insomnia to get worse. Those who have other types of sleep conditions like sleep apnea, it can affect them. It's very similar to traveling. When you're traveling to another country, your circadian rhythm gets thrown off, your sleep suffers, and that can lead to other things. Yeah,
the commonly referred to as jet lag, that's all part of the same thing. Is there, I guess, a lot of people are on board with this. They say just get rid of the whole daylight saving time to begin with. I don't know that there's any health benefit to that, is there?
I don't know necessarily that there's any health benefit in getting rid of the daylight saving time, but I can tell you that a lot of people do go through this disruption twice a year, once during the fall season, once during the spring. Fall, I guess, is not as difficult because we actually gain an hour, but it becomes more difficult when we lose that hour for everybody, not just for sleep reasons. But specifically for sleep disturbance, it is a problem for many people. So, typically what I advise my patients to offset that, because the thing is that it's only 1 hour. So if we can introduce this change gradually rather than all of a sudden an hour difference, our bodies would cope with it better. Our circadian rhythm would cope with it better. So what I suggest is instead of going to sleep an hour early or late, do it gradually in increments of 15 to 20 minutes. And then, so you're allowing your circadian rhythm to get adjusted to it without it being shocked.
Oh, okay. Let me see if I understand. You're saying, excuse me, before we actually turn the clocks back, maybe spend a few days going to bed, 15 minutes, 15-minute increments earlier? Is that what you're saying? So that
is, yes. That way, when that time change happens, your body's already used to it to some degree, as opposed to you just all of a sudden having to turn the clock back by an hour. Yeah,
that makes sense. Like, I've never been a sound sleeper my entire life, and when I saw you were a cardiologist, I thought, well, I wonder if there's some heart issue with sleep. I had a quadruple bypass open heart a year ago, February. Never any problem, never any pain, the scar down the middle other than that. But if I sleep on one side or the other, it wakes me up. And I never really thought much about it because I don't sleep that well anyway. But I guess what I'm hearing more and more of, this daylight saving time is really messing some people up out there that are super sensitive, or I shouldn't say super sensitive, but they're sensitive to different time elements when they're trying to sleep.
It is. You asked a very important question. How does sleep relate to our health, overall health, and specifically cardiac health? It's very important. And as a matter of fact, the American Heart Association just added sleep as one of the risk factors, just like the other risk factors, like, high blood pressure, high cholesterol, diabetes. Those are all risk factors for heart disease. And now sleep is another one. So if we're not getting adequate sleep or restful sleep, that is a problem, and that can increase your cardiovascular risk factor. So I definitely think that those who have sleep disturbance or insomnia, they should definitely speak to their physicians. There are treatments available so that they can get to the bottom of why they're having difficulty with sleeping.
Yeah, I got a great cardiologist, Dr. Weiss, and he's not the one that performed the surgery, but yeah, to a person, they all say you got to get your sleep. And of course, when you're young, you think, well, they're just making you go to bed. But as you get older, I talk for a living 3 hours a day. And if I don't get 6 to 7 hours of sleep, solid sleep, I lose my voice after the first hour. And I never have figured that out. If I get 6 or 7 hours, I'm good for the entire show. And used to, it wasn't that way. So I guess that's just a process of aging, right?
It is partly, yes. Many things could be contributing to that. I would definitely urge you to talk to your doctor and make sure you don't have sleep apnea and what level it's at. So those things need to be considered as well.
Well, I know one big factor is a 98-pound shepherdor that jumps on the bed from time to time in the middle of the night, and it's kind of hard to ignore that. Dr. Fahmi Farah, I appreciate very much you jumping in on this. It's something you don't really think about. I don't even know that I make a conscious effort to turn the clocks back until the next day or day after. But hey, if it affects your heart, take it serious. If it affects your sleep and that's affecting your work, take it serious. I appreciate your time very much.
Thank you so much for having me. It was my pleasure to be here.
Thank you so much.